I'm pleased to connect with you from the various territories and communities where you're at today. So let me begin by welcoming everyone who is joining us today. I know many people in Sault Ste. Marie faced a long and challenging winter living with the realities of COVID-19. It has been very difficult. And now we are in a third wave, watching hospital intensive care units fill up across the province. But there is good news too. Vaccination campaigns are ramping up across the country, so there is hope that we are nearing the end of this very difficult experience. Still, we have to remain vigilant. As new variants emerge, the spread of COVID-19 continues to accelerate in Canada. This is not the time to relax our guard. The Government of Canada remains focused on protecting the health and safety of Canadians and reducing the spread of COVID-19. As part of this effort, we are addressing the underlying issues faced by vulnerable people that are at a higher risk of transmission during the pandemic. The latest evidence indicates that individuals facing social and economic challenges, including those living in crowded housing conditions, are at a higher risk of contracting COVID-19. We know that crowded housing conditions can make it unsafe or impossible to self-isolate, increasing the risk of community transmission. As part of our rapid response tools against the spread of COVID-19, the government is providing $100 million for municipalities all across Canada to establish voluntary isolation sites under the Safe Voluntary Isolation Sites program. This program helps to address the needs of the most vulnerable populations during COVID-19 pandemic. Through the Safe Voluntary Isolation Sites program, the Government of Canada is providing $336,000 to the District of Sault Ste. Marie's Social Service Administration Board to operate a safe voluntary isolation site in Sault Ste. Marie and the Algoma District. This funding will support 8 rooms to accommodate individuals who are unable to safely self-isolate at home. Each room will provide a safe, comfortable place to self-isolate, and the decision to stay there is entirely voluntary. The Public Health Agency of Canada is continuing to work with the provinces and territories to identify other municipalities and regions that would benefit from the funding offered through the Safe Voluntary Isolation Sites program. We know that COVID-19 spreads easily within households, especially when there isn't enough room for people to self-isolate from others. The Safe Voluntary Isolation Site in Sault Ste. Marie will help limit virus spread and keep residents in this community safer. And that's great news for everyone. Now, before I finish, I just want to remind people to continue to follow all public health precautions to prevent the further spread of COVID-19. We all have to adhere to these guidelines to keep the caseloads manageable. Hand washing, physical distancing, staying home, and getting a vaccine when it's your turn. We must join with everyone in our communities to battle this pandemic. Thank you. Merci. Chimigwich. Now I'd like to turn over the virtual stage or mic to Mayor Provenzano for comments on behalf of the City of Sault Ste. Marie. Mr. Mayor.
Thank you very much, Terry. Appreciate the opportunity to be here and share a few comments. I want to recognize your government's efforts throughout the pandemic in financially supporting the country from coast to coast. And I want to thank you for this specific funds that you're providing to our community here in Sault Ste. Marie. It's clear and important that we need to continue to follow public health advice as the COVID-19 pandemic has accelerated, frankly, in Ontario. And while we're not seeing the same numbers in Sault Ste. Marie and Algoma as we are in some of the other parts in Ontario, that can change quickly. So we have to do everything that we can to make sure that people are safe and that people that need our help have our help. It's clear that we need to avoid crowded spaces and congregate settings, and having these resources in place to allow us to give people the supports that they need to do that is important. In that respect, I want to recognize and thank Mike Nadeau and social services in our community. They work tirelessly a year round to try and support and help people in our community who need that help. I want to thank Mike for his leadership and his collaborative approach to problem solving. He's always looking to work with other groups in our community and to find solutions that can assist those people in our community that need the assistance. Before I pass it to Mike, I want to just recognize Dr. Liu and her team at Algoma Public Health. I don't think we have a deep appreciation throughout the city at how tiring this has been on the entire staff at Algoma Public Health. We are long into this now. I see and understand the frustration in the community. I see and understand how tired the community has come to this point. I want to recognize that and acknowledge it, but I also want to recognize all the people that day in and day out are working on trying to keep us safe. Algoma Public Health under Dr. Liu's leadership has done an admirable job in our community, and I'm really appreciative of it. I want to thank her for her leadership, and I want to thank their team for the contributions they've made to keep our community safe. And in closing, before I pass it to Mike, I just want to take the opportunity just to ask the community to really commit to public health advice. We need to work as hard now as we ever have to keep ourselves safe, our family safe, our loved ones safe, and by extension, our community at large safe. So I want to thank everybody for taking the time to be with us today. I want to thank the Government of Canada for providing these funds. I want to thank Mike and his team for going after the funds, and Jennifer and her team for all of their good work on a day-to-day basis. So with that noted, I will pass the speaking opportunity on to Mr. Mike Nadeau from the Social Services Administration Board. Thank you, Mike.
Thank you, Mr. Mayor, for the kind words and the recognition of the entire organization and team. I would also like to thank MP Sheehan for supporting this initiative and this funding opportunity. This would not have happened without his direct involvement in trying to make sure that we had a safe, voluntary, safe isolation solution for the community. This funding that's being announced today is immeasurable in helping us in our fight against COVID-19. Oftentimes, many people within our community are overhoused or live in crowded housing conditions where they are not able to self-isolate in a safe and comfortable manner to reduce the spread of COVID-19. This funding today will allow us to secure 8 hotel rooms within the community to serve those who have exposure or risk of contacting the disease, and allow them to make sure that they're isolating in a safe environment, that they're properly fed, properly cared for. It will also allow us to hire dedicated support services to make sure that we're supporting this site for the next year. The DCEP is incredibly grateful to the federal government for its support, but we're also incredibly grateful for the city of Sault Ste. Marie's support and Algoma Public Health leadership. This funding proposal was developed in partnership with Algoma Public Health, and Dr. Liu actually called me early in the new year and identified the problem that we were having in our community and a potential solution. So we deployed Lauren Dockstader, who's the social equity coordinator for Future SSM. She wrote the proposal, took up the charge, and we're very, very happy that we were successful in our grant ask. We do think that this will go a long way in supporting our whole housing system as we collectively fight against COVID-19. So thank you very much for the kind words, Mayor. Thank you very much for the support, MP Sheehan. And I would just like to turn this over to Dr. Liu, who I agree with, whose stewardship and leadership throughout this pandemic has been second to none, and has been a wonderful, wonderful partner for social services and the broader marginalized community. So miigwech.
Thank you very much, Mike and Mr. Mayor, for those kind words. So I first of all want to again echo the tremendous thanks that we have to you, Mike, and your team that you have provided to so many Algoma residents this past year, and for helping to bring a safe voluntary isolation site here in Sault Ste. Marie. This is not just a collaboration, though, between Algoma Public Health and Sault Ste. Marie Social Services. I want to thank and acknowledge the Public Health Agency of Canada and the local agencies who are supporting this program, including Pauline's Place and the United Way, who are partnering to provide participating clients with food and essentials. The COVID-19 pandemic has certainly been a long and grueling journey for so many of us for over a year now. This virus has attacked our communities, the health of our families and loved ones, and it's cost us lives, livelihoods, and the precious ability to be together in person. But it has not in any way shaken our commitment together as a community to take action and to take care of one another, especially those who are disproportionately impacted and who are in particular need. This program is just one example among so many others of local public health in action. That's fellow community members and partners coming together to protect health, promote health equity, and doing so day after day, week after week, month after month, with an untiring spirit of courage and compassion. So my final thank you goes to all the residents of Algoma who have not only done their part to stay apart and stay home, but have also risen to the challenge of the pandemic by stepping up and stepping forward to help take care of our fellow community members in a time of need. Thank you.
Thank you, Dr. Liu, and thank you to all the speakers today, Parliamentary Secretary Sheehan, Mayor Provenzano, and Mike Netto. We're now going to proceed to the media Q&A session. Any media wishing to ask a question can do so by using the raise your hand feature. I'll then call upon you to ask your question. You will be unmuted. And then I will kindly ask if you could state your name and media outlet, who you would like to question. All speakers will be available for your questions. And then go ahead. We ask you limit to one question and one follow-up. And if you do have any questions or experiencing technical difficulties, you can call 613-957-2983 for the Public Health Agency of Canada Media Relations. Okay, Darren Taylor, you can go ahead and ask your question.
He might be on mute and not be aware he's on mute.
Possible. Lori, is Darren unmuted? Or Darren, can you check if you're muted? Okay, we will move on. We'll come back to Christian Davino. So Lori, if you can, Christian, if you can unmute yourself, or if Lori, you can unmute him, you can go ahead.
Hello, can you hear me?
Yes.
Perfect. Just my first question here is for Terry. In the health minister's initial announcement of this funding, she said other sites were also being finalized, like Thunder Bay. I'm just wondering, are there any plans in store for other northern communities in Ontario, such as like Sudbury, North Bay, and Timmins?
Well, Christian, thank you very much for that question. And currently, this this program that Minister Patty Hajdu has unveiled, is available to the province of Ontario, but specifically as well to the Toronto Public Health region, the Peel Public Health, the Ottawa Public Health, the region of Waterloo, the City of Windsor, and Thunder Bay. So Sault Ste. Marie will be joining those communities in receiving this very important voluntary isolation site.
Sorry, could you just clarify that a bit? I'm just curious, are there any plans in store, though, for Sudbury, North Bay, and Timmins?
Oh, this program is available, and it's an ongoing application process. It's in Ontario right now, and Ontario communities certainly can apply to the Public Health Agency of Canada, as well as will be rolling out to the rest of Canada as well. So it's available to whoever wishes to apply and can demonstrate the need for it. And there is a process that goes forward. So I wanted to thank, and take this time for thanking both the Algoma Public Health Unit, the City of Sault Ste. Marie, and the District Social Services Boards for, jumping on this quickly because it's so important to have this resource to combat COVID-19 and to make sure that there are people that have a voluntary, isolation site. So, Christian, that the best way to answer that is it's open for any community to apply that wishes to do so.
Okay, just one more question for APH, if I can, for Algoma Public Health. Dr. Liu, just curious, are these sites going to be things like hotels, motels, or other facilities in Algoma? And have you also been receiving more community complaints of public gatherings within the region?
Thanks for the question, Christian. So the first question, the response is yes. These are 8 rooms, hotel or motel rooms that are within the community. And again, social services team has been working closely with a lot of local partners to make sure that these are safe and comfortable spaces for people. And they've also partnered with us at Algoma Public Health to make sure all infection prevention and control practices are in hand at each of these rooms and spaces. So in terms of your second question, certainly we know that very recently we have entered into our third state of declared emergency in this province. We are under the province-wide shutdown once again and the stay-at-home order. And as you know, this means that indoor gatherings of any kind are now prohibited. It is not legal at this point in time to have visitors over. It's not legal right now to go over to our friends for coffee and to gather indoors with friends or relatives. It does take time always for the community to switch and to realize that these new rules are in place. And we are working very closely with our law enforcement partners across the district to make sure that this education is provided, and where there's ongoing non-compliance, that we do use an enforcement approach.
Thank you, Dr. Liu and Christian. We're going to move on now to Elaine Della-Ma from the Sault Ste. You will be unmuted shortly, Elaine, and then you can go ahead. There you go.
Good afternoon. I guess my first question is for both Dr. Liu and Mr. Nadeau. We're already over a year into this pandemic. Why is this being identified as a potential issue just now? And I guess what was done during the first year of this problem? Are numbers indicating that these vulnerable members of our community are getting COVID and don't have those safe places for self-isolation? Or is this just a new problem?
I can certainly start, and perhaps Mike Nadeau can chime in. So this is absolutely not a new problem. Right from the get-go, we knew that there could be and would be situations where we would come across people whose households and housing situations make it really hard for them to isolate properly. Not every one of us are going to be in that privileged position of having their own separate bedroom, a separate bathroom to self-isolate. There are multi-generational families in our communities. There are lots of young people who are pooling their resources together and living in close quarters. We're also a border community, and so sometimes there are unexpected returning travelers who need to quarantine as well. And so we were, throughout the pandemic, working very closely with social services, even before the availability of this funding from the federal government. But certainly once the funding was announced, we saw that this was an excellent way to really make this program sustainable and much better resourced on the go forward, so that it's not just a roof over people's heads, it's safe transportation there, it's the food and essentials and all the ancillary supports as well.
Thank you for the question, Elaine. To be clear, social services and Algoma Public Health have been dealing with this since the pandemic began. I've been working with Dr. Liu last fall to outline that the funding that we have received to date from the Ministry of Municipal Affairs and Housing, it was getting very, very stretched, and there was fiscal pressures, and we were just concerned about not being able to do so. So we have been doing this on an as-needed basis throughout, but the resources that we had did not allow us to have a proper, fully funded strategy. So this opportunity that was flagged by Dr. Liu, it just provided immense fiscal relief to our budget, because we were doing so. We just did not have the dedicated resources in budget to be able to make sure that we could continue to do so on an ongoing basis.
And if I could just chip in just very quickly too as well, Elaine, because those are great comments for Dr. Liu and Mike Nadeau too as well, is this is another tool in the toolbox. And I've worked with Mike before on, say, the Reaching Home funding, which we doubled up to almost $840,000 for this area. So this will go hand in glove with a number of other initiatives that Mike has and Dr. Liu and the mayor where the federal government has supported. So again, this is just one more tool, and in particular now with the variants, it is even, which are much more highly transmissible too as well, that this is even more important today. So again, thanks to everyone for their continued work in supporting vulnerable people in this riding.
Okay, do you have a follow-up, Elaine?
Yes, I do. Thank you. And I think this one will be directed to Dr. Liu too. I just want to follow up on Christian's question with regards to gatherings. Dr. Liu, I see Algoma Public Health put out a letter to parents of St. Mary's College students today, telling them that the isolation period for the grade 9 cohort investigation ends at midnight, etc. What did that investigation reveal? And you talked about enforcement. Are there any enforcement measures being taken in that particular case?
Thank you, Elaine. So as with any exposure in any group setting, whether it's a school or a daycare or a workplace, we do make sure that there's very clear instructions and notifications to the impacted workers and families for the duration of the period. So there's initial instructions to the group in terms of what to look for, what kinds of symptoms, where and how and when to get tested. And then as that quarantine or isolation period ends, we provide an update, whether to confirm that everyone is good to go at the end of that period. And again, this is part of our usual and routine process. And with regards to the enforcement piece of gatherings, again, from Algoma Public Health standpoint, our focus is always the health of the people and the public. And we work very closely with local law enforcement partners where there might be breaches of current COVID-related regulations. So where those investigations are ongoing, we don't provide active comment on them, but certainly they are part of our ongoing work wherever there are potential breaches to COVID legislation.
Thank you, Dr. Liu. We're going to move on. Elaine, if you have a further question, you can put your hand up again and we'll come back around. So we're going to move on to Darren Taylor. Darren, you can go ahead as soon as you're unmuted. Darren, you're unmuted on our end.
As his Zoom is an older version, it won't work.
Oh, that's unfortunate. Okay, well, you can follow up with your question to the Public Health Agency of Canada with the number that I gave you, or Darren, you can email MP Sheehan's office and we'll point you in the right direction. Okay, so I believe Elaine has another question. So we will move on. Go ahead, Elaine, as soon as you are unmuted. Go ahead.
Great, thank you. Thank you. Can Mike, maybe perhaps you can just explain how this process will work for those that may need that safe isolation site. Can you kind of take me through a case example, and explain the process and what someone needs to do if they found out they're COVID positive, don't have a place to self-isolate on their own? They come to you, what happens?
Yeah, okay, great question. So when someone is identified that they're COVID positive or that they have been a close contact and they need to self-isolate, that would presumably go through Algoma Public Health. Algoma Public Health would put us in contact with the individual or supply the individual with one of our staff, the dedicated lead contact information. And what we would do is we would then make contact with the person. We would work with the local hotel to make sure that the proper PPE and safety requirements are put in place, make sure that the person is transported to the hotel, the safe isolation facility properly. Then they would be put into the hotel room, and we would make sure that meals are provided, that if there's any discretionary items that the person would need to be taken care of, just to ensure that they are properly following the public health isolation recommendations. We would just make sure that the person is properly supported within that hotel unit until Algoma Public Health notifies the individual and the DSAB that the isolation period has subsided and the person is now safe to exit. Again, if there are people that we've had people who have been referred to us from public health, we've also had people referred to us from the City of Sault Ste. Marie Police, at different times whenever they're talking to people. So So we're looking at trying to communicate this across the community at large, but we do believe that it will be a really, really close synergy with Algoma Public Health staff and my team to make sure that it is seamless and that all the supports are required to make sure that the person's experience is pleasant, and more importantly, that they do not inadvertently infect someone else with the virus.
Great, thank you. Thank you.
Thank you. Thanks, Elaine. Okay, we have another hand up from Dan Gray.
Hello.
Hello, go ahead, Dan.
Dr. Liu,
Mr. Gray, can you state what media outlet you're from?
with Sue Online.
Thank you.
Yes, Dr. Liu, can you say whether for sure that, yes, hang on one moment. Sorry, is that better for feedback?
It's fine on our end. Go ahead, Jen. All right, I think we'll move on. We're getting some technical difficulties here.
I don't know what to say.
Dan has got his hand up again, Lori, so we can give it another try.
Can you guys hear me now?
Hi, Dan, we can hear you.
Yep, thank you. Dr. Liu, can you confirm whether any of the recent rise of cases that we're seeing in the community are related to some of the previous events that are under investigation?
Can you be more specific as to which events?
In relation to the party that is well known to have gone on the Easter weekend, are we seeing many connections back to that?
So I can certainly provide some general observations. As you know, we don't provide additional commentary on individual cases. We did observe that, across all of our cases, the method of how they acquired their infections was through gatherings. Sometimes it was a large gathering. For the vast majority of these people, they are acquiring their infections through the very common close contact routes. So as soon as one person in a household is infected, a lot of times other members of that family and household also acquire that infection. And we're also seeing that people are gathering with other people in other homes, so they are not necessarily realizing the importance of the stay-at-home order. People are, for example, getting their infection if they're sharing meals with someone that they don't live with. People are also getting infection if they're coming into close contact with other people. It could be indoors, it could be outdoors. People, I think, have a misperception sometimes that it is safer outdoors, and certainly that's true, but it is not completely protective. If people are outside and they're close together within that 2 meters without any masks on, we have seen that this has also led to infection. So the recent cases, certainly the chains of transmission are from one household to the next. Some of them are linked to larger gatherings, but many of them are just those day-to-day interactions that, when it's not a pandemic, seem very benign. But unfortunately, right now, this is what is causing our ongoing rise in cases.
Thank you, Dr. Liu. And one more question for you. Can you confirm if there's any current staff at APH who are off on COVID restriction?
No, unfortunately, I cannot comment on that. That's not something that we would publicly comment on.
Okay, thank you.
Okay, thank you. We're going to move along. Darren, we're trying one more thing to see if we will be able to hear you. If you can unmute yourself and try speaking, we may be able to get you. Can you try that? Well, I guess that didn't work. So thank you very much to everyone who joined us.
I'm unmuted now. Can you hear me now?
Oh, Here we go.
Okay.
Yes.
Well, thank you for your efforts. And by the way, Zoom usually does work for me, but it's not working for me today. But it's working now. Thank you.
Great.
What steps, and this would go to Mr. Sheehan and or Dr. Liu. What steps are the authorities going to take to make sure people are, encouraged to voluntarily isolate? What penalties will be put in place for those who don't voluntarily isolate? And how long is this going to be voluntary? And can you see this spreading to other quote unquote average homes?
With the Darren, the whole program, which has been approved by Health Canada, the local health unit is the one that is charged with overseeing it, and so there's a referral process that's involved, which is to be endorsed by the local health unit, and in this case, the Algoma Public Health Unit. So I'll turn that over to Dr. Liu to share how that process would work.
All right, thank you, Terry. Dr. Liu.
For sure, Darren. So whenever someone is notified that they are either positive for COVID-19, so they're ill, or they have been informed that they're a close contact of someone, so they've been exposed and might be getting the virus, we are right away in contact with these folks directly, and we advise them of the next steps to take. So first off, if someone is sick, we make sure that if they are elderly or have any comorbidities and other conditions, that they're very closely monitored. And we work very closely with our local doctors and hospitals to make sure that at any point in time, if these individuals need escalation in their care, that they are taken to the hospital and provided that care appropriately. And throughout their period of infectiousness, they are closely monitored by a public health nurse. Of course, during this time, we advise them to stay strictly isolated. So that's staying at home and staying away from other members of the family so that as much as possible, we don't infect additional people who are living with their family member. The vast majority of the time, there are no issues with this because people know that it's the right thing and the responsible thing to do to be able to stay safely at home to recover and to stay safely at home once they've been exposed. If there are situations where someone with an infectious disease is not isolating, and if they are behaving in ways that might jeopardize the health of the public and expose others, and it's not just COVID-19, there is actually a very long list of communicable diseases in Ontario called reportable diseases or diseases of public health significance, where these are straight away reportable to public health. And if these folks are not able, for whatever reason, to behave and conduct themselves in a way to avoid exposing others, we do take further action. We can issue what is called an order for them to isolate and to comply with the directions of, for example, the hospital or other healthcare providers. And when this is done, we often work again with our enforcement partners locally, because once such an order is issued, it means that it would be an offense if they were to contradict the instructions in that order, and they would be liable to fines up to $5,000 a day. Typically, this is not the route we want to go. Our goal is not to punish or fine people. It doesn't help anyone. Our goal is to make sure that they get the care they need and they avoid of exposure to other members of the public. So vast majority of the time, we work with them to be able to find a safe space to isolate. And again, coming back to the safe voluntary isolation site, this is an example of just how we're doing that. And in a lot of situations, people want to do the right thing, but they're not well resourced and they're quite vulnerable and aren't able to do that. So this program is one way that we're providing these supports in our community.
Thank you, Dr. Liu.
You have a follow-up, Darren?
Yes, I believe Mr. Nadeau was saying 8 hotel rooms. Are these 8 hotel rooms set to go now? Are they occupied now, or where do we stand on that?
You're muted, Mike.
Thank you for the question, Darren. So the funding provides us with the opportunity to contract and get up to 8 rooms moving. We have been working with local hotels today, so we have the capacity within the system. They're used periodically. So we have not had to go up to, we had 14 at one time. We have not had to go up to that number. However, we do need to make sure that they are secured so that as if a surge ever was to occur, that the system has the capacity to respond. I'd also just like to reiterate that the safe voluntary isolation shelter initiative is not geared to our homelessness population. We have different strategies and resources for that, as the MP referenced Reaching Home, for example. What this funding is targeted for is people who are overhoused or just do not have the capacity to self-isolate within their existing structure and need assistance to do that. Oftentimes we've had referrals and questions from people who maybe be working in a long-term care facility, and they had an exposure and they did not want to go back home and didn't have the proper space to be able to do that. So that's where this tool within the toolbox will come into play. We've also had people who from work have had to travel outside of the district or even outside of the country, and then there was a potential exposure. So whenever they came back, we've had to respond. So we do have the infrastructure set up. We have the network set up, and it's willing to fully engage when the need arises.
Okay, thank you, Mike. Thank you to everybody, all our speakers today. This now concludes our event, and thanks for the participation. Enjoy the rest of your day.
Thank you, everybody.